My name's Annie. I'm a nurse with Summit County Public Health. Thank you for being here today, even though it's just a small group. Super important education. So I hope if you learned something today, you'll tell a friend or someone else to please join us for one of our other upcoming trainings. We have one on Monday at the pad. It's going to be awesome. And then on August 31st, we have our International Overdose Awareness Day event. It's a film screening at CMC and Breck. We're going to have lots of heavy appetizers and mocktails, tons of resources for sexual health, behavioral health, mental health, and substance use. So please join us if you're interested. We are going to talk about opioid overdose today and then how to recognize and respond using naloxone. Got it. So why is this training important? This training is super important because about 1 in 10 adults report that someone in their family has died from a drug overdose. 1 in 6 say someone in their family has had an overdose that required a hospitalization or an ER visit. 66% of adults feel like they themselves or their family member have experienced addiction issues or the impacts of addiction. 3 in 10 adults say they or someone in their family have been addicted to opioids, and that number increases to 4 in 10 for adults who live in rural areas like here in Summit County. And that study was provided by the Kaiser Foundation, and it just recently was published in 2023. So there's a ton of information out there about fentanyl. A lot of it is true. Some of it is not so true. A lot of it is very confusing. So I think it's important that we clear up some of the myths about fentanyl. It is a potent synthetic opioid drug. It was approved by the FDA for use as an analgesic and anesthetic, meaning pain relief and sedation. It is 100 times more potent than morphine, 50 times more potent than heroin. And then legally, it's produced in patches, pills, IV, and even lozenges. But illicitly, it's typically injected, snorted, smoked, or swallowed, or sometimes even ingested without people knowing. You cannot overdose from just touching fentanyl. That is a myth, but it is very dangerous, and a lethal dose is just 2 milligrams. Fentanyl has some pretty profound effects on our central nervous system. Our central nervous system is what's responsible for keeping us breathing, blinking, swallowing throughout the day without having to consciously remind ourselves to do those things. So fentanyl typically is a central nervous system depressant and other opioids as well. So they slow down the function of all of our normal activities. So it could cause some changes in someone's consciousness. They could be kind of sedated, sleepy. It can cause upset stomach, nausea, vomiting, dizziness. Respiratory depression is a huge one that we see with opioids. So because those opioids are confusing our central nervous system, they're affecting that breathing mechanism. So CO2 and oxygen are in our bodies at a certain level, and our central nervous system tells us when it's time to breathe out and blow out some of that CO2 and replace it with oxygen. When we take opioids, we kind of confuse that system, and our body no longer really knows when it's time to breathe. So it kind of stops reminding us to breathe. Sometimes we stop breathing altogether, and that is known as apnea and then respiratory failure. We also see people's heart rates go down quite a bit, slow down. So bradycardia when someone has opioids in their system. And then at high enough doses, we're going to see unconsciousness and anesthesia. Fentanyl was first approved by the FDA in 1968, and it was only available in a combination with another drug called droperidol. Droperidol was identified as a drug that caused a really bad high when used recreationally. So they thought by combining it 50 parts droperidol to just 1 part fentanyl, they would reduce the risk of abuse for that drug. But it's pretty scary to think about. Even in 1968, they recognized that fentanyl had the potential to be a drug of abuse. By 1972, just 4 years later, fentanyl was available by itself, but only available in a 1 milliliter vial containing 50 micrograms. And this 50 microgram dosage is actually still what's used as a standard dose in the hospital for pain management. It is pretty hard to get prescribed fentanyl these days, really only used in cases of end-of-life care or severe cancer pain. By 1974, fentanyl had completely replaced morphine as an anesthetic. It does have some positives: faster inductions, quicker onset of those pain relieving effects, shorter duration of action. So people woke up from anesthesia feeling a little bit better, less nausea, vomiting, itching, things that we see with morphine as an anesthetic. And it was more potent. So you needed less of that drug, which was cost saving for not only the facility, but also for the patients as well. Now in 2023, fentanyl is extremely cheap and easy to produce. It can be made super discreetly in underground labs. It's not like other substances that we've seen, like opium, that requires large fields, water, manpower. It can totally be made underground discreetly by just 1 or 2 people, which makes it even harder for us to track it. It has no smell or taste and an extremely high street value. So 1 kilogram, which is about 2.2 pounds of fentanyl, could be worth between $4 to $6 million on the street. So there's a lot of incentive for people to continue to distribute. There are 3 known waves of the rise in opioid deaths in the United States. The first occurred in 1999 with the release of OxyContin as a pain medication to treat all sorts of pain and breakthrough pain as well. There was some serious overprescribing of that medication. It was also right about the time when there was a push to create the pain scale that we actually use to assess pain today as well. And so those kind of went hand in hand in this idea that if people were reporting any sort of pain at all, it needed to be treated with opioid medication. By 2010, we started to realize that, okay, maybe we're over prescribing these opioids. Maybe zero pain is just not achievable for most people on a day-to-day basis. Part of being a human is just experiencing pain a little bit. So there was a huge push by the government to stop over prescribing opioid medications. And they did a ton of training with physicians, and it actually really worked. Physicians stopped over prescribing opioids. However, we had this huge group of people that were already addicted because they had been getting those opioid medications from their physicians for 10 plus years at that point. So it left this huge group of people kind of addicted with nowhere else to turn. They didn't have a legal avenue to get their medication anymore. So they started to turn to heroin. It was cheap, easy to find, and more accessible than the opioids they were used to taking. So in 2010, we started to see a lot of deaths attributed specifically to heroin. A few years later, around 2013, fentanyl, carfentanil, and other synthetic opioids kind of hit the market and became more widely available. And we started to see those heroin deaths kind of decrease or flatline, and then synthetic opioid overdose deaths really skyrocket. And then it's possible that we could be kind of seeing another wave in this pandemic, post-pandemic era. We know that a lot of elective behavioral mental health services access was limited. So people started to self-medicate a lot, and we started to see a huge rise in deaths attributed to synthetic opioids, especially fentanyl, kind of during the pandemic. So we haven't called it an official wave, but there's definitely been an increase in deaths. So illegal production continues to be on the rise. We talked about the fact that it's made in a lab. It's very discreet, it requires few resources. It has been found laced into pretty much every single street drug, including counterfeit pills. So counterfeit Xanax, oxycodone, and Adderall are huge ones for our youth population, but fentanyl specifically has been found laced into pretty much every substance on the street. So heroin, meth, cocaine, and then those counterfeit pills. A lethal dose is just 2 milligrams. There's some examples up on the screen. So that is more than a lethal dose on the pencil there, more than a lethal dose next to the penny. And then up in the right-hand corner, there is what would be representative of a lethal dose of heroin compared to a lethal dose of fentanyl. So it is in there. You might have to squint to see it, but we're really just trying to illustrate that a lethal dose of fentanyl can just be a couple grains of salt worth. And 1 kilogram, so again, 2.2 pounds of fentanyl has the potential to end over 500,000 lives. Fentanyl is now involved in more deaths of Americans under 50 years old than any other cause of death. So it's causing more deaths in motor vehicle accidents, cancer, heart disease, COVID, gun violence, suicide, and homicide. That number used to be 136 people dying every single day in the United States of an opioid overdose. But as of January 1st, we had to increase that number to 154 people in the United States every single day. Here is some data on specific drug involvement in overdose deaths from 2010 to 2022. There is some Colorado specific data as well as Summit County specific data up on the screen. So in 2021, in Summit County specifically, we had 7 overdoses, 6 of them involved in opioid. And then in 2022, we had 10 overdose deaths and 8 of them involved in opioids. So we're continuing to see a rise in the number of deaths attributed to opioids, not only in Colorado, but here in Summit County specifically. So that blue line is representative of other opioid deaths, so besides fentanyl. And in 2016, 2017, the federal government put in place a lot of harm reduction strategies to try and address the opioid epidemic in the United States. And it did seem to kind of work on other opioids. However, it did not touch fentanyl. For some reason, that red line represents fentanyl, and we continue to see fentanyl deaths specifically skyrocket despite all of those efforts that the federal government put into place. So where is youth getting access to fentanyl? This is a different game than when you and I were young. We have to acknowledge that social media has been an amazing thing. It keeps us all very connected, but it can also be a dangerous thing. It's providing a lot of access to a lot of different people. You can exchange money online. You can speak entirely, in code using emojis or on apps that parents or other people that do have your best interest in mind maybe don't have eyes on. So I think it's just important to be realistic and realize that not only are these drugs more potent than ever, but they're also more accessible than ever, which makes them slightly more dangerous. Seizures of pills containing fentanyl increased 834% between 2018 and 2021. In July of 2022, the DEA was seizing an average of 2,200 pounds of fentanyl every single month. So that means they're now confiscating more fentanyl every month in the United States than they did in the entire year of 2018. And they're estimating that that represents about 5 to 10% of the fentanyl that's coming over the border. A lot of people think we're in Summit County. This is paradise. It's absolutely not happening here. So I think it's important to be realistic. We live on I-70, which is a huge hub for people going back and forth from one end of the country to another. It's a really easy stop to just drop off some substances on their way. So we are not immune to this epidemic. There have been confiscation of fentanyl in Georgetown, at Copper. It is here in Summit County. And these are all articles from 2023, specifically from Colorado. So it is happening here. There are 3 levels of prevention. Primary prevention is this. It's educating people, providing facts, letting them know how dangerous of a game it is to use substances in today's world, providing trainings as well. And secondary prevention is providing all of those tools. So that's aimed at people who are already possibly using substances. We have naloxone, we have fentanyl test strips, we have strategies for safer use. We know that at 40% of overdoses, there's someone else present. So that's 40% of overdoses that do not have to result in death. And then tertiary prevention is all about providing access to resources for recovery and treatment when people are ready. Fentanyl test strips. So there are a couple of different versions of fentanyl testing kits. Summit County Public Health is proud to hand out these rapid response strips. This is just a singular strip. You hold it, in a couple drops of water mixed with the substance for about 15 seconds, wait 1 minute, and then you're going to get a result, either 1 solid line or 2 solid lines. That's going to tell you positive or negative. So fentanyl test strips are a cheap and really easy way. They're free through public health, but an easy way to, make smarter decisions about substance use. If you know what's in your substance, if you know that it potentially does contain fentanyl, maybe someone's going to make a different decision, use a different dealer, use with a friend, have naloxone on hand, use less. So knowledge is power, and this is a harm reduction strategy aimed at meeting people where they're at on their journey. It's not supposed to enable people to use drugs more safely, or feel like they can use more of it. It's all about knowledge. Knowledge is power. So why we talk about fentanyl so specifically is because when it comes to opioids, all opioids kind of have a different window for our response time. When we look at something like heroin, which is another opioid, it could take up to 30 minutes before someone reaches respiratory depression and up to 90 minutes before they're going to enter cardiac arrest. With fentanyl, these effects can happen really, really quickly. So 0 to 2 minutes after somebody ingests fentanyl, they could start to experience respiratory depression, be unresponsive within 5 minutes, and then anywhere between 5 to 20 minutes, their heart could completely stop. So it's extremely important that we learn to recognize the signs of opioid overdose so that it's second nature. You know those signs like the back of your hand, and you know exactly how to respond because our window for response is really short. Even if someone doesn't die from an overdose, there's always the potential for brain damage just from a lack of oxygen. So, talked a lot about naloxone. Naloxone is an amazing medication. It is available over the counter. There's also available for free in Summit County through public health, the sheriff's office, Red, White, and Blue, and the care clinic. And then we have some partners also that table at a lot of our events and hand that out for free as well. It is an opioid antagonist medication, meaning that it does the opposite of what opioids do to our system. It is available on the market in a couple of different preparations. The generic name is Naloxone, just like adhesive bandage. And then the brand name, like Band-Aid, would be your Narcan or Kloxxado. So Naloxone is the generic name. That's the medication that it is. And it's in both of these, Kloxxado and Narcan, and they can both be used to safely and effectively reverse an opioid overdose. Both preparations of Naloxone can restore normal breathing in just 2 to 3 minutes. Now, Naloxone will get metabolized by the body pretty quickly in about 60 to 90 minutes. So it's always possible that someone could slip back into overdose and they may need multiple doses. So we have opioid receptors all throughout our body, which is exactly why opioids have such a profound effect on the entire body. But we have these receptors that are designed specifically to fit opioid molecules. So other molecules that are shaped differently are not going to fit on these receptors. They're just ready and waiting for opioids specifically. When we take too many opioids, they fit on too many receptors. It kind of confuses that central nervous system, and the body starts to build a tolerance because it's trying to protect itself. So over time, someone's going to need more and more and more of that opioid in order to get the same effect that they were getting the first couple of times that they used it, which is exactly why overdose becomes more and more likely with continued use. When too many opioid molecules sit on too many receptors in the brain, it kind of floods and overwhelms that respiratory system. We lose our desire to continue breathing, and then someone's going to slip into overdose and stop breathing altogether. Naloxone molecules are designed to mimic the shape of opioid molecules. So it kind of tricks the brain when we administer naloxone and it finds those receptors. The receptors think, oh, more opioid molecules. So they're going to allow that pink opioid molecule to be released from its receptor, and the naloxone is going to bind instead. By the time the brain kind of figures out, oh, whoops, that was not more opioid, that was a trick, that was naloxone, it's a little too late, and naloxone is sitting on that receptor and acting as a protective mechanism so that no other opioid molecules can come and bind to those receptors. Without opioids being bind to the receptors, there's no way that that opioid is going to have an effect on the body. So again, that naloxone medication is going to have a 60 to 90 minute duration of action. And depending on how many opioids someone has in their system, it may take multiple doses to reverse that opioid overdose. So each box of naloxone always comes with 2 separate doses and 2 separate applicators in individual packaging. And that is regardless of whether you have the Kloxxado or the Narcan, they each come with 2 doses. There's always going to be instructions on the box. So underneath the front label on the pink box and on the back of the orange box, there's also always instructions inside each of the foil packets. So even if you didn't want to carry the box around and you just wanted to carry the foil packet in your med kit or car or something like that, that's totally doable. There's directions in there as well. You're going to pull the medication out of its foil packaging and be left with this nasal applicator. Second and third fingers on either side with your thumb on the plunger. This goes up the person's nose all the way up until your fingers are flush with their nostrils. It's kind of far, but that's okay. We're going to get it all the way up there and give one good spray. And then that is 1 dose of naloxone administered. It is really hard to mess it up. Just go straight up the nose, 1 good spray, and then you're left with your second dose. We always, always, always want to call 911, even if that person comes right back from their overdose, they're breathing normally, they're talking to you, they're begging you not to call 911. It's really important because of that potential to slip back into overdose in 30 to 90 minutes, depending on that person's metabolism, how many opioids they have in their system, what their tolerance is. It's important that we call 911 because there would be nothing worse than reversing someone's overdose, leaving them, and then having them slip back into overdose. So there are laws that protect both the victim and the responder, and we'll talk a little bit about that as well. But please call 911, even if that person is begging you not to. You're both protected. EMS is also trained to address the symptoms of withdrawal. So if this is somebody that does have, a substance misuse issue or uses a lot of opioids, it is common that we could send somebody into overdose because we're taking those opioid molecules right off of their receptors very quickly. That's okay. Withdrawal is not a side effect of the medication. It's just something that happens when someone's opioids are removed from their receptors, but EMS is trained to address those symptoms, and they have things that can help with that as well and make that withdrawal a little bit easier on the person. So it is important that you protect yourself and also notify EMS so that they can help protect that person as well. Is naloxone safe? We get tons of questions about this. So naloxone will have no effect on somebody who does not have opioids in their system. If I were to open this right now and administer it to myself, absolutely nothing would happen. So it's safe to use even if you don't know exactly what happened. If you didn't see the person go down, you think, it could have been opioids, it could be something else, we could go ahead and administer because we could only potentially help someone. We cannot hurt someone. It is safe to use in children of any age and in pregnant women. Like we talked about, it can cause some of those withdrawal symptoms, which can be kind of severe and scary. So it is important that we always give that warm handoff to EMS. All right. So again, signs and symptoms of opioid overdose. We're thinking about that central nervous system that controls all of kind of our normal day-to-day functioning, slowing way down. So someone might have really, really small constricted pinpoint pupils. They're probably going to have a decreased level of consciousness. They might even be completely unconscious, or they might just be sleepy and confused. A lot of times they're going to have a decreased respiratory rate, again, because we're confusing that respiratory system. You may hear no breath sounds at all. That's another sign they're not breathing. You might also hear kind of a choking, gurgling sound from the back of the throat. It's very, very scary. We call it the death rattle, but it is a great indicator that someone is not getting oxygen and they need naloxone. They're probably going to be unresponsive to your stimuli. So even if you're shaking their shoulder or shouting at them, they might not be super responsive. They're going to have decreased blood pressure. Blood is not flowing throughout their body the way it normally would be. So their skin's probably going to be cold and clammy. And then we start to see a blue tint around the lips and the fingernails, which is another indicator that we are low on oxygen. So if you think someone is experiencing an overdose, my first step is I'm going to try to get a reaction out of them. So just like CPR, I'm going to shake and shout, "Hey, can you hear me? Can you hear me?" If I don't get a response, I'm moving straight to my more painful stimuli. You can, if you want to try it, you're more than welcome to. Take a hand, make a fist, find the pointy part of your knuckles. That goes directly over the breastbone. You kind of press down hard and rub up and down. It does not feel good. If someone is conscious at all, they're going to respond to you. So if I shake and shout and don't get a response, and then I do my sternal rub and I still don't get a response, I am moving straight to naloxone administration. Going to call 911, and ideally these steps kind of happen at the same time. Call 911, put them on speaker. "Hey, somebody's down. I have naloxone. I'm going to use it." They can talk you through the steps of how to use it. And then you'll also have that timer going. So we're going to get out our naloxone. We've called 911. They're keeping us calm. The person is laying flat, ideally, or even if they're sitting in a chair and their head is kind of tilted back, we just kind of want their head tilted back so that this medication can get absorbed well. This goes up their nose, spray, and that's one dose administered. That's when the clock starts, and we're trying to wait 2 to 3 minutes to see if they start to breathe normally. If they don't start to breathe normally within 2 to 3 minutes, I'm going to get out my second dose and repeat the exact same process. So we can continue to administer doses every 2 to 3 minutes until either they start to breathe normally or until EMS gets there. If EMS arrives, cooperate with them, let them know how many doses you've administered. If you know what time the person went down, you can help them by providing that information as well. If the person starts to breathe normally again, or they start to, become aroused a little bit, you start to hear some noises or grunting or groaning, you can roll them onto their side. That's going to help any secretions that are coming, whether it's vomit or just spit, to kind of drain out the side. We don't want someone laying on their back where maybe they would choke on their own secretions. So rolling them onto their side, and they can stay in that recovery position, just breathing, laying down until EMS arrives. Sometimes it does help to let them know, "Hey, my name's Annie. I administered a dose of naloxone. You're totally fine. I'm here with you, and I'm going to stay with you." Just make sure that they're comforted and that they know they're safe. Also, sometimes that's affirmations for yourself. We're okay. We're here. We're safe. Because it can be traumatic for you as well. There's an awesome app called OP Rescue. I highly recommend that you download it. There's a sticker on every single one of our boxes of naloxone that we hand out that has a QR code directly to the app. You can identify signs and symptoms. So if you're kind of unsure, could this be opioid overdose? Could it not? They can give you a list and help you decide. You can start rescue, and it'll walk you through the steps of exactly how to administer whatever preparation of naloxone you have. You can get resources on recovery and treatment, where to get more naloxone near you. and you can also anonymously report that a dose was given and whether it worked or not. So it's an awesome app. I hope you never have to use it, but I hope that you have it on your phone just in case. So legislation, you are protected by the Good Samaritan law in the event of a drug or alcohol related emergency. If you report that to a healthcare professional, law enforcement agency, or 911, as long as you stay with the person and cooperate and with EMS or law enforcement when they arrive, letting them know how many doses, all the information that you do have. This protects you and the victim as well, that the person that experienced the overdose from prosecution. And then the third party naloxone allows someone other than a healthcare provider to safely administer this medication to someone experiencing an overdose without being in trouble or facing any sort of criminal repercussions from that. Okay. I always get questions on whether providing naloxone is enabling. The studies have shown that there is no abuse potential for naloxone. In studies of 5,000 opioid users, they found no increased incidence of heroin use when given naloxone, really only better outcomes. And then some awesome resources that we have here locally. At the very top are 2 national resources. And then the Front Range Clinic provides MAT services here in Summit County, as does the Care Clinic and Summit Women's Recovery. We also have some amazing behavioral health providers here tonight to support and provide resources and education as well. All right. Anybody have any questions? I know that was a lot of info. That is a great question. The question was, is it okay to leave it in the car? So there are some temperature indications on the box. I believe excursions are permitted up to 104 degrees Fahrenheit. And it says, if frozen, please defrost before administration. So ideally, we want to keep it at room temperature, but in the event of an emergency, if you needed it, absolutely go ahead and use it, even if you think it's been exposed to extreme temperatures. The same guidance also applies for the expiration date. We try to only hand out boxes with, a year or 2 out in the future expiration date, but the current best practice is if you are in an emergency situation and you have expired naloxone, the law does protect you to go ahead and administer it. These formulations of consumer products in the nasal spray formula came out in 2014-15. So we're still kind of learning more about the shelf life stability and temperature stability. But in an emergency situation, go ahead and use it. You couldn't hurt someone. You could only potentially save someone's life. Great question. Any other questions? Nothing? Okay. Well, I will be available for the next little bit. We have resources. There's tons of naloxone test strips out there. So please help yourself. Take some snacks, beverages, educational flyers, and naloxone, and we'll see you out there.